Today I'm here with Ken Gorney, physician's assistant with Sparrow Hospital. Thanks for being here, Ken.
Pleasure to be here.
So we're going to talk a little bit about something that affects almost everyone out there. Mental health, behavioral health, people dealing with dementia or family members with dementia. Tell me a little bit about how women specifically have to think about this.
Well, in terms of women alone, we do know there's some statistics out there that show women generally outlive men considerably, a lot more in terms of years of longevity. And then they find themselves usually in a position where they're having to be the caregivers of their spouses or even younger family members that often encounter illnesses with dementia, for example.
It's really interesting, and obviously it would affect their personal mental health if they are taking care of their spouse or their spouse passes. How should they deal with that type of situation in their lives?
Well, that's a very difficult position for just about anybody to encounter, but when you're having to be a caregiver for these patients that experience these terrible illnesses, they find themselves in a position where they're grieving all along. They're grieving the loss of the person's memory and the personalities that change along the way. And then as that person eventually passes, then they're experiencing another loss along with that. So, I think a lot of preparation in terms of finding support groups in the community or turning to other family members that could encourage them would be very helpful.
That's wonderful. Thank you so much for all of that great information. And that's been another Capitol View.